So, Doctor, we'll go on to the audience questions now. We have quite a few of them which have been sent in, and I think we did answer some as well. The first one is colorectal cancer in younger adults different from those in older adults?
That's a great question. And I think that to some extent the answer is yes. There have been a couple of different studies that suggest that there are some different mutations that we see in younger patients than we see in older patients. It's not absolute. It's not absolutely true. There are some younger patients whose tumor genetic profile looks the same as an older patient's would. But I think that as a population, there's certainly studies that suggest that there are different gene mutations that we see in younger patients than we see in older patients, and some of those do have therapeutic implications. So from that standpoint, yes, there are some differences in younger versus older.
Mm-hmm. We have another question, which is, I think you did mention vitamin D some time back. So the question is, does vitamin D really protect against colorectal cancer?
That's not that clear at this point. I think that the main basis for suggestions for vitamin D is the Nurses' Health Study that suggested that nurses back in the 80s and 90s who were taking vitamin D regularly had a lower risk of having colon polyps. And so the thought was and has been that that decreased risk of colon polyps would translate into a decreased risk of colon cancer. Having said that, that's not that clear. That second step has followed. That is to say, even though there was a decreased risk of colon polyps in those nurses, it's not as clear that there's decreased risk of colon cancer. And there have been a couple of other similar studies that have looked at vitamin D, and they haven't had the same association with the decreased risk of colon polyps. So I think that it's not clear that vitamin D prevents colon cancer. So the context that I've always discussed it with my patients, and I think I had the same discussion with Mrs. Marish once upon a time, was that if there are other reasons for somebody to be on vitamin D, I don't think that it'll hurt. But it's also very difficult to say, yes, you should absolutely take vitamin D because it will definitely help. I think that part is less clear, and but if somebody has osteoporosis or is at risk for osteoporosis, and that's a reason for them to be on vitamin D, an additional benefit, something else to try to get them, an additional potential benefit, an additional reason to try to encourage them to take something that may be beneficial as well. Maybe it'll help with the colon polyps as well, but I don't usually tell patients, yes, you should do this to prevent colon polyps. It's maybe it'll help, but it's certainly not my first strongest recommendation.
Mm-hmm. Okay, thank you, Doctor. The next question is, I think you touched on this as well, about a study on physical activity reducing growth of colorectal tumor cells. So the question is, can Dr. Hwang comment on this?
I'm sorry, can you?
I think the
the
news article. Yeah, that's fine. The news article actually talked about short bursts of intense physical activity reducing the growth of colorectal tumor cells. So can Dr. Hwang comment on this?
I'm not sure that the data is very clear, in my opinion, about whether one type or another of a physical activity is preferred. And with regards to duration, with regards to intensity, it's a hard thing to study in terms of ultimately what the impact on a colon cancer cell ends up being. So I think that when it comes to people, it's hard to say, no, you must do this type of activity in order to benefit, because I think the data is not at all that clear. My personal discussion with patients tends to be, it's most important that you're doing something from a physical activity exercise standpoint. I think that it's hard to prescribe one over the other, and because not all patients can do all of them anyways. But I think that I would say that it's not to my mind and my studies, I don't think that it's clear that one type of physical activity or exercise is better than the others.
Mm-hmm. Yeah, right. Yeah, so we have another question, which is, what are some of the things a person can do to reduce the risk of colon cancer? So are there any guidelines? Yeah.
So, so from a prevention standpoint, from somebody who has no clear risks or no personal history, I would say that there's certainly no specific guidelines. I think that the general discussions that are had are high fiber, low fat diets are beneficial. I think that decrease would suggest that I know how much red meat anybody is eating, but minimizing red meat intake may be beneficial. I'm not one who says you can't have anything. As Mrs. Marish has heard me say in the past, I believe most things in moderation are fine. I think that doesn't mean you can't have any red meat, but I'm not sure you want to be going on a diet where you're having red meat every night or every other night or something like that. But I think that a high fiber is a beneficial thing. Low fat is a beneficial thing. I think that lower red meat is a beneficial thing. And then, as the other preceding question had alluded to, I think exercise is an important thing. Those are probably the main things that one can do to prevent that, as well as, again, doing the screenings, because I think that if we can find a polyp before it can turn into cancer, we can prevent cancer in that fashion.
Thank you, Doctor. I have just one last question before we can wrap up. So that question is, what are some of the clinical trials that patients should be tracking?
I'm sorry, what are some of the critical what?
Clinical trials.
Oh, clinical trials.
Clinical trials. Yeah.
So it depends on the it depends on the patient. It depends on their it does depend on their genetic profiles specifically. One of the things that's become challenging in the development of treatments in patients with colon cancer ends up being that because we're now looking at smaller and smaller groups based on some of the genetic profile findings, not everything that we learn will necessarily apply to everybody. So we'll see. I think that when we're looking at the rectal cancer studies, I think that the most exciting ones that we're waiting to get the studies finished and then be able to evaluate end up relating to preoperative. Do we give chemotherapy before surgery, before radiation, before surgery? Because ultimately, part of the question with those kinds of studies may lead to the possibility of, well, does everybody need surgery to begin with for rectal cancer, and the potential, with the potential being that maybe they don't all need surgery. So that's really one of the biggest ones that we're looking forward to as a community. But frankly, those results probably won't be available for a couple of more years, and even that will be some of the preliminary results. The second set of studies that I think more universally may be applicable will be the one I alluded to earlier for patients with metastatic colorectal cancer getting initial chemotherapy with or without immunotherapy, because that's a study that, number one, it's looking at immunotherapy in the early setting when patients haven't had a lot of chemotherapy, and then secondly, because it's what we would call mutation agnostic. It doesn't matter what a patient's tumor mutation profile is, and so it may be broadly applicable. And so I think we'll learn a lot from that pair of studies that may apply to a lot of different patients. But it'll still be a while before we get those results.
Thank you, Dr. Hwang. According to the American Cancer Society, there will be more than 100,000 new cases of colon cancer and more than 44,000 rectal cancer cases diagnosed in 2019. And colorectal cancer may cause over 50,000 deaths this year. However, 90% of colorectal cancers are preventable, but 1 out of 3 people who should be screened aren't doing it. So with the message of screen, prevent, and treat colorectal cancer, Dr. Hwang, thank you so much for sharing treatment options and the latest research, trials, and screenings in colorectal cancer with us today. Amy and Johnny, thanks a lot for your participation and bringing in the patient's perspective into this discussion. We would also like to thank Levine Cancer Institute and also the audience for all the questions that you've sent in. The talk will be available on CureTalks.com. Please visit our website for details on all upcoming talks. Thank you and have a great evening, everyone. Thanks a lot.
Thank you.